My presentation is on gestational diabetes. What is gestational diabetes? This is a form of diabetes and it only happens during pregnancy. So these mothers, they become pregnant and they had no issues with their glucose until pregnancy, and that is the term for it is gestational diabetes. And the cause is unknown, but the placenta causes a release of certain hormones that activate themselves to fight against insulin. So you need the placenta for the baby to grow, but you're also contradicting with the mom because the mom is having a lot of issues controlling their glucose. So that's wherever the diabetes issue comes in. So it's so important to learn about these types of diabetes because we have pregnant women who showed no symptoms and they don't know they have it, and this could affect them and the baby. And a lot of abnormalities, a lot of complications can arise from this complication. So we want to make sure every mother has the ability to get tested and know that we have resources that can help them. So maternal testing is you have a test between 24 and 28 weeks, depending on your doctor and your visits. And the first test is a 50-gram 1 hour oral glucose test. So the mother will drink this certain drink as displayed in the picture, and then they will have their sugars tested afterward in an hour. And if their glucose is over 140, then they are obligated to the 100-gram 3 hour test. But however, if the mom, let's say, has a blood sugar of 100, she is fine, she tested negative, so the second test will not be necessary. So the people at risk are African Americans, Hispanic Americans, Native Americans, people with a BMI of over 30, maybe who are expecting twins, triplets, quadruplets, and having high blood pressure. And if they've already previously had a baby that has been an LGA or large for gestational age baby and or a 9-pound baby, that does display a risk for them. So maybe they will get tested at an earlier date, maybe closer to the 24-week range. So, like I said, most women do not show symptoms, but if it gets out of hand and the blood sugar just becomes very unstable and there needs to be something addressed with it, a lot of moms will show an increase in thirst, maybe more hungry, that blurred vision, and maybe just becoming more tired. So it's very similar to other diabetes signs and symptoms, but as a mom who's pregnant, who's expecting, they just, they feel tired already. They have to drink more water and, they are hungry all the time. So it doesn't seem as there's an issue as it could be this. They think it is a normal pregnancy, sign and symptom of it. So this is very minimal effects of the mom and the fetus, but I just picked a few that I thought were really common. So for mom, it's having more issues with pregnancy and postpartum weight. So preeclampsia, postpartum depression, having an increased risk of developing type 2 diabetes, maybe just having a complicated birth, having to have a vacuum assisted or a forceps delivery. And then for the baby, they could be LGA or large for gestational age. So that means they are over the 90th percentile on their birth plot. They could have breathing issues at birth. So maybe some respiratory distress they're exhibiting. They're not able to breathe fully on their own. So they may need a little bit of assistance with some oxygen. They are at increased risk for jaundice, which is that yellowing of the skin, and they'll have maybe some glucose instability themselves because they go from this high glucose environment to completely shut off, so they have a hypoglycemic effect, making them lead to cold stress, which can lead to them losing more weight and temperature instability. So hypoglycemia is never a good thing for a newborn. So treatment for gestational diabetes, it's frequent monitoring, and many moms can just work on their gestational diabetes with a balanced diet and some exercise. So that's typically what the doctor will first prescribe is a balanced diet and give them some food options. And then if they come back, the sugar is still unstable, that's when they will resort to some insulin therapy for very good control of the diabetes. So it does depend with mom compliance. It depends with the mom's reaction. We can't always fix with just healthy eating, but that is our first step. So these are my sources.